Today, the subcommittee is meeting to consider two bills. First, we have H.R. 7516, the Purchased and Referred Care Improvement Act of 2024, sponsored by Representative Dusty Johnson. This legislation would amend the Indian Health Care Improvement Act to hold the Indian Health Services, or IHS, completely and fully liable for payments for authorized purchased and referred care, or PRC, services instead of the patient. The IHS provides health care to approximately 2.7 million American Indians and Alaskan Natives through a network of more than 600 hospitals, clinics, and health stations on or near Indian reservations. When IHS cannot provide a needed health care service for a patient through this network, the PRC program allows a private provider to give needed care and then bill IHS for it. However, when IHS does not pay the bill, that private provider usually seeks payment directly from the patient. Rather than purchased and referred care, tribal members have seen purchased and unreferred care, resulting in them being hounded by collection companies and seeing their credit scores adversely impacted. Patients should not be held liable for the IHS's inability to function properly. H.R. 7516 will ensure that it is abundantly clear that IHS is who is liable for the PRC-related care payments and not the patient. Additionally, H.R. 7516 would allow any patient who pays out of pocket for IHS-authorized PRC services to be reimbursed by the IHS no later than 30 days after submitting the necessary documentation. Second, we have H.R. 2687, sponsored by Representative Mary Peltola, which would amend the Alaska Native Claims Settlement Act to exclude certain payments to aged, blind, or disabled Alaska Natives or descendants of these Alaska Natives from being used to determine eligibility for certain programs. Excuse me. The Alaska Native Claims Settlement Act, or ANCSA, settled the Aboriginal land claims of Alaskan Natives. Alaska Native Corporations, or ANCs, were established to receive land and payments through the settlement and also to promote the social, cultural, and economic advancement of their Alaska Native people and their communities in perpetuity. When Congress enacted ANCSA, Section 29 stated that no provision of the act would replace or diminish any obligation of the U.S. or Alaska to, quote, protect and promote the rights or welfare of the natives, end quote. Excuse me. In 1988, Congress amended ANCSA to exclude the first $2,000 that any Alaska Native received from an ANC when determining eligibility for means-based benefits, such as the Supplemental Nutrition Assistance Program, or SNAP. These 1988 amendments also allowed Alaskan Native corporations to create settlement trusts as a tool for the distribution of benefits from the corporations to Alaska Native beneficiaries. However, Congress did not exclude settlement trust benefits from being used in determining an individual's eligibility for government assistance programs as they had with other benefits from ANCs. As a result, many Alaska Natives, particularly those who are over 65, blind, or disabled, find themselves in the position of having to choose between receiving their settlement trust income or qualifying for government assistance programs. H.R. 2687 would rectify this by excluding settlement trust income when determining eligibility for means-tested federal benefits for aged, blind, or disabled Alaska Natives. Both of the bills on today are technical and small fixes that could have a large impact on individuals' lives. Often, Congress can be perceived as only focusing on the big ticket or national items, but we all know that these local issues generally have a major impact, particularly for individual Native lives. Since I have been chairman of this subcommittee, this has been one of the primary issues that has been brought to my attention. And we've had several hearings involving the IHS, and we've brought folks from around the country. And this is something that is, I'll use the word again, terribly troubling. We made some commitments to these folks, and it is time that we meet those commitments and that we fix this system. One of the ways to do that, I think, is to address the fact that we understand that there are some IHS area offices that have significant PRC carryover funds. In other words, they're holding the cash instead of spending it and doing what they're supposed to be doing with it. So, with some regions having carryover in the tens of millions of dollars, I obviously find that terribly unacceptable. How much of this carryover is due to PRC purchase orders that have not been reconciled or otherwise closed out by the IHS? And does the IHS have an action plan to address this backlog of open purchase orders so that the individual tribal members are not contacted by providers to pay these bills?
Congresswoman, thank you very much for that question and actually for your commitment to bringing this forward. This is something that is shared by Director So, and it was reflected in PRC being one of the top 3 issues on her work plan for IHS, as well as clearing the OIG recommendations from the OIG report that highlighted the challenges. In terms of unobligated funds, one of the steps that she's taken is really setting a target of only 10% to making sure that dollars are flowing out. In terms of your specific question, I would like to be able to get back to you with that on the data of how much are unobligated funds from claims that have not been processed.
And I'd also like to have a timeline as to when that will be addressed, that these funds are actually spent on the people that are entitled to that money to make sure that this does not continue to happen. Another follow-up question is that the HR 7516 establishes a mechanism for PRC service reimbursements to be completed within 30 days by the IHS. And in your testimony, you mentioned that this timeline would be impractical, even though the IHS handbook requires the service to pay PRC claims on a 30-day timeline. What is the practical difference between 30 and 45 days?
Congressman, I think I actually want to start with a place of we should never have dollars going from tribal members out. Pay and chase is not a goal. So to be able to say, what can we do to stop even having that should be the place of emphasis, and there are parts of the bill that get to this. In terms of that 30-day reconciling, it is a matter of the staffing, which has been referencing, making sure that we are meeting our statutory obligations, but in constrained staffing and constrained budgetary times, giving us the ability to have a goal, but also to have the flexibility to make sure that we are following the law.
Well, what is the medical industry standard for reimbursement when a patient pays a medical bill that insurance should be reimbursing them for?
Congresswoman, there is not actually a standard, and it's part of the reason that Congress has passed several pieces of legislation to keep, I'm going to put this in quotes, patients out of the middle when there's a conflict between providers and insurers. Reminder that IHS is a direct care organization and not an insurer, so a lot of the mechanisms that are in place for billing do not exist within IHS for reimbursing patients directly.
So I know that this is an important issue to you. I know it is an important issue to you, but after 15 months of hearing about this from our tribal members, it's an incredibly important issue for this committee as well, and I really encourage the IHS to do everything that you can to fix this. I'm going to go to Mr. Frank White-Clay. In your statement, you provided details of situations where individual tribal members have been impacted by IHS not paying the PRC bills. I'd invite you to expand on your statement and ask if there are any further examples you'd like to provide to the committee, because I think it's extremely important that we document the problems and the challenges that your members are facing.
Thank you, Chair Hagerman. Yes, there's we'd be here all day if I got to all the issues that came out with IHS on PRC issues alone. We'd be here for another week if it was all the IHS issues compounded. But just in one instance that I gave out earlier on the young woman that was denied for her college loans, we have issues of a elderly gentleman, an elder of my tribe that's a veteran, actually paid out of pocket. He had hearing aids that through the PRC program, and he went to get them recalibrated through that and actually was authorized through PRC, and the service provider denied him that care specifically because IHS hasn't paid that bill for that patient directly, and he had to pay out of pocket. And I asked him, and when he was going to get his reimbursement, he said, I don't know. It's been a few months now, and I don't think it's ever going to come.
Has it been resolved yet?
No.